We have great news for those of you suffering with nighttime numbness, tingling, and pain in your hands. Our next guest is the inventor of a patented device and procedure that's painlessly simple, affordable, and allows you to get back to activity in days instead of weeks. And that means a good night's sleep could literally be a phone call away. Dr. Brian Gerbala tells us how it works.
Most people that have carpal tunnel syndrome will notice immediately that they're having numbness and tingling in these 3 digits of their hand. And sometimes it starts off by just occurring intermittently when they're working with their hand, or if they're riding a motorcycle or a bike, or sometimes working with tools. Those fingers will go numb and they'll have to shake their hand. But then it progresses to nighttime numbness and tingling. And when it gets severe, they spend a lot of time at night trying to get in a comfortable position, which they really can't get into. And so it becomes something that not only affects their hand and their physical function, but it also affects their sleep, which affects their cognition, it affects their mood. And so it becomes more than just a physical problem at that point. It becomes both physical and psychological. So my professional advice is that patients should avoid waiting and call us now, because they can spend weeks and months, and in some cases even years, undergoing expensive, unnecessary tests, spending thousands of dollars in copays and deductibles and other fees, and countless hours in waiting rooms without ever fully getting this problem taken care of. We can make the diagnosis and, if necessary, quickly perform the minimally invasive tunnel tone procedure in a single office visit. Most doctors do an open procedure, which involves an incision about 1.5 inches long, and we're able to reduce that down to about 1/4 inch to 3/8 of an inch using high resolution ultrasound to visualize everything under the skin. And so I can see things under the skin with highly accurate precision that allows me to avoid the nerves and blood vessels. And then I have a special instrument that's patented that I developed that allows me to release the carpal ligament and take the pressure off the nerve through that tiny incision safely. That targeted device allows us to do it through a much smaller incision. And so compared to other doctors, because the incision's much smaller, it allows you to recover quicker and get back to work in days instead of weeks or months. We avoid wearing a splint, we can avoid physical therapy in most cases, and there's no stitch to take out later, and so you only really have to come for one visit.
There was no pain. First he done the sonogram, then he did the incision, and he did it right here in front of me. It didn't hurt, didn't bother me or nothing. It's just a tremendous relief. I mean, when you wake up in the middle of the night from severe pain in your arm and in your hand, and then you have this done and it's not there, it's fantastic.
Dr. Gerbala's office-based diagnosis and treatment offers lasting relief, is performed in a single visit, and could save you thousands of dollars and weeks of recovery time over traditional procedures. So stop and call him at Carpal Tunnel Express and start to live life to your fullest now.